We can survive weeks without food, days without water, but only a few minutes without air. Every day we take around 20,000 breaths, but we don't think about it. Breathing is automatic. But what if the air we breathe is making us sick? Unlike spoiled food or dirty water, we don't really see the pollutants in air. They are invisible. And yet these tiny particles travel deep within our bodies to all the organs and cause disease. The result is one of the biggest health threats of our time. Today, the average Indian is breathing air, the quality of which is about 10 times worse than the limits set by the World Health Organization. And this is not just a big city problem. Air pollution affects people living in villages, towns, cities all over the country. Hello, I'm Soumya Swaminathan, and in today's episode of Science Simply, we will explore how air pollution affects our health, why it is one of India's biggest public health problems, and what we can do to clean the air that we breathe. When we think of air pollution, we are thinking about smoke that's coming out of factories or out of vehicles, and of course that's true, but a lot of pollutants are invisible. And the WHO actually classifies air pollutants as particulate matter, or what we call PM, gases like ozone, carbon monoxide, sulfur dioxide, and nitrogen dioxide. Let's start with particulate matter. So these are actually little droplets in the air, which is composed of soot and all of these gases and water vapor. When we say PM10, we mean particles which are 10 microns in size. That's about 1/5 the width of a human hair. So the PM2.5 is even tinier particles, 2.5 microns, that can actually go through the lungs into the blood and travel to different parts of the body. And this is why air pollution impacts and causes diseases beyond the lungs. It increases the risk of stroke, of heart attacks, of diabetes, even of dementia. And when young babies and children are exposed to air pollution, it can even impact their brain development. In 2013, the International Agency for Research in Cancer, an affiliate of the WHO, classified air pollutants as causing cancer. Another major pollutant is ground level or tropospheric ozone. So ozone actually forms when the emissions from vehicles or from waste matter burning or from factories, they react with ultraviolet radiation and the sunlight and produce this ozone. Now, ozone is very harmful when it is breathed in. In fact, doctors describe it as causing a sunburn of the lungs. So they can cause acute respiratory distress, they can worsen asthma and lead to also chronic lung damage. We have other gases like carbon monoxide, which is again produced from vehicular emissions and factories. In fact, carbon monoxide binds with the hemoglobin, so it reduces the oxygen carrying capacity of the blood. And if inhaled in very high doses, we know that it can be fatal. Similarly, we have sulfur dioxide and nitrogen dioxide. These are all gases that are produced from emissions, from waste burning, from different sources as irritants of the respiratory tract and is linked to worsening asthma. Air pollution, both indoor and outdoor or ambient air pollution, is thought to cause almost 8 million deaths a year according to WHO. And approximately 2 million of these deaths are in India. That means that the death is in some way caused by air pollution being a major risk factor. In fact, air pollution is now a bigger risk factor than smoking or unhealthy diets. And when you're exposed to air pollution over a prolonged period of time, then of course you have many other diseases that you become susceptible to. So it doesn't necessarily make you sick overnight. However, cities that have implemented strong policies and reduced air pollution levels have seen an almost immediate impact on admissions in hospitals due to heart attacks, for example, showing the immediate health benefits of acting on air pollution. And this is why more and more researchers are now recommending that instead of using a simple air quality index, we actually use an air quality health index or an AQHI, which links the levels of these air pollutants to the health status, and will be able to provide an early warning or a supporting tool to people who can actually take action, preventive action, based on the level of pollutants on a certain day and based on their own underlying health vulnerabilities. Air pollution looks different where you live and how you live. In rural areas and people who cannot afford clean fuel for cooking, the burning of biomass becomes a major source of pollution, and this particularly impacts women and children who are likely to be in the kitchen during cooking. And of course, it also contributes to outdoor air pollution. In big cities, a lot of the ambient air pollution is coming from multiple sources. It's coming from factories, it's coming from transport emissions, it's coming from waste burning, it's also coming from the household biomass burning, and it could be also coming because of construction dust, also contributing especially to the PM10. So air pollution is also not limited by city or state boundaries. So this is why it's a shared problem. It's across city and state borders, and we need to take what's called an air-shared approach to really seriously tackling the problem of air pollution. There are some parts of the country like the Indo-Gangetic Plain and particularly Delhi and the National Capital Region that often suffer from very high levels of air pollution, especially in the winter months. But really, if you look at data from air quality from across the country, a large part of the country actually does not meet the quality standards that have been set by the National Clean Air Program. The good news is that cleaner air is possible, and we have actually good stories and evidence from around the world. Take London, for example. In the 1940s and 50s, it was known for the great smog. And recently, when I was in London, I found the AQI was 3, with a breakdown of pollutants in different parts of the city. And this is because they've recently introduced the ultra-low emission zones, where they've really restricted the entry of cars into the central parts of London and encouraged pedestrian, cycle use and public transport. Similarly, we've seen in China going from pre-2013, when it was described as an airpocalypse, very high air pollution levels, you could barely see the buildings across the street in Beijing, to a point where they've 60 to 70% reduction in air pollution over the last decade or so. This has been done by multi-sectoral action plan with a lot of investment by the government and ensuring that the rules that have been formulated are actually implemented. And this has also resulted in a reduction in cardiovascular mortality both in London and in China. So again, the evidence linking air pollution to health is very, very clear. In India also, we've made progress. We have the National Clean Air Program, and recently we've seen the Delhi government launch the Swachh Hawa Swasth Delhi campaign, which again links air quality to people's health and is an excellent example of a 5-year multi-sectoral plan with science-based actions to improve air quality. Solving air pollution will require government action, industry participation, and community effort. We need to improve air quality monitoring. So we need monitors in many more places, especially in rural areas and in small towns. Secondly, we need the authorities, the pollution control boards, to act on the data that is emerging from these monitors, because they're able to then pinpoint the sources of pollution. We need to bring in more new technology, of course, both in renewable energy that India is already doing very well in terms of solar energy and wind energy and so on, replacing fossil fuels. But we also need to improve technologies that can help reduce emissions from factories, from vehicles, and again, a move towards electric vehicles, especially the large buses and the trucks would be a step in the right direction. But rules alone will not be enough. We will need, of course, strong governance and implementation of those rules. We should also look at the whole solid waste management sector as one of the key pollutants that we need to address. We also need to keep reviewing the data. Policymakers need to keep on updating and adapting the policies based on the data that's coming in. And again, linking air pollution data with health data would improve both the decision-making ability of government, but also would help ordinary people take decisions to protect their health. Our actions as individuals also matter, and here are a few simple things we can do. Try to take public transport or walk or cycle or carpool whenever possible. Segregate waste at source, because mixed waste ending up in garbage dumps and landfills is a huge source of all of these very harmful pollutants. Conserving electricity, obviously trying to switch to cleaner forms of energy wherever possible, also cleaner cooking fuels. Staying informed about air quality in your part of wherever you live, and monitoring that closely and advocating for cleaner air in your own community. And we can learn more about what's happening through looking at pollution control board portals of your own area to understand more about the monitoring and the data that's being collected in your own neighborhood. Air pollution is one of the few health risks that we all share because we all breathe the same air. And so we must make a collective effort to improve the quality of the air. And we also know that cleaner air is possible with the right policies, with better technology, and with public participation. So every cleaner bus that we have, every tree that is protected, every factory that follows emission norms, every household that switches to a cleaner energy source for cooking, all of these bring us one step closer to our goal. Because clean air is not a privilege. It is the foundation of good health, and it's something that we all deserve. This is Science Simply. Thank you for listening.